All right. Good morning, everybody. So, my name is Maggie. I'm from Weller Health Education at Lehigh Valley Health Network, now a partner with Jefferson Health. So, what Weller does is we are a non for profit education group that travels to schools and does really awesome health education programs. Not only do we educate students, we even do education programs for parents, for faculty, really anyone who is willing to listen and get great resources on different health topics. So primarily we teach to students who are in K all the way up through 12th grade. We talk to students about a variety of topics. We talk about everything from brain health to mental health to bullying to online safety. But today we're in for a really awesome topic. Today we're talking about drugs, specifically ones you can find at the gas station. So I think this is a really important topic because when we talk about drug education, primarily our brains go right to the illegal drugs like heroin, cocaine, all those other drugs that you guys have learned about many times in things like health classes. It's really important you guys are educated on those types of drugs just because of the severe effect they have not only on your life but also on your health as well. But this is a topic that I think a lot of people don't think about when it comes to drugs. Our brains don't really go to things that, oh, I can buy over at the gas stations right now, whether you're 18, 21, 15, 14, doesn't matter. These are things that are widely available and you can buy it pretty much any day, anytime. So let's chat about it. So why exactly are we talking about this? All right, because if it's sold at gas stations and convenience stores, it's safe, right? It's at the stores, you can buy it. It should be good for you. That shouldn't be bad for you or dangerous, but that is absolutely not the case. So friends, even at gas stations and any local convenience store that you go to, 7-Eleven, Wawa, Sheets, wherever you like to go when you need to pump gas, grab a drink, grab a snack, you're going to see whole sections of that gas station convenience store devoted to different types of substances. I know it may seem like, oh, well, it's with food, it's with, I don't know, groceries. That must mean it's healthy for our bodies, but absolutely is not. The gas stations are able to sell a lot of different types of substances, and they're able to kind of get into these little loopholes when it comes to laws, and especially in how these substances affect the body too. All right, so what are the risks when it comes to gas station drugs that are sold? Okay, number one, the products are sold legally, so a lot of these are legal. All right, it's not like they're violating any laws or the gas station is going to get in trouble for selling it to students, especially for ones that are legal for any age group. The problem is they're not really well regulated. A lot of these types of things that are sold at the stores, they don't really have laws when it comes to how it affects the body, how it affects the brain, especially your brains, because your brains are still developing right now. Next up, some of them are highly addictive. Some of these substances, although they are legal, they are highly addictive when it comes to how they affect the brain. That means after only using it even just a few short times, your brain can change chemically and you become really dependent on that substance to make you feel normal, to get through the day, even to just feel like yourself. They can pose some really bad health effects. All right. So when you're taking some of these substances, which we'll talk about which types later on, they can change your heart rate. They can make you feel nauseous, sweating, confusion, vomiting, and many, many more. Many of them actually have really bad health consequences, specifically for you guys. Because, like I said, your brains are still developing. Take a guess on when you think your brain stops developing. Answer is around 25. A lot of people are surprised that your brains develop until then. Most people think it's 18 or 21. So your brain is growing and changing and developing all the way up until you're around 25 years old. So that's a long time left for your brains to become the best that they can be. So the consequences that we see on the substances sold at these gas stations, they are extremely bad for youth brain development. And we'll talk about how later on. Next up, they can be a gateway to using other types of drugs later on down the line. So, a lot of kids who end up developing addictions later on to those really hard illegal drugs I mentioned earlier, they started out with other things, things that were around their house or they got from friends, or more often than not, they bought at gas stations. And finally, guys, there are a lot of unknown ingredients. All right. So, we don't always know exactly what's in these products. And for some of the ingredients that are listed, some of those are safe for other ways. So, for example, we're going to talk about smoking and vaping today. Some of those ingredients are safe for ingestion, which means eating, but not all of them are safe for inhaling. So we'll talk about that later on. Okay. So, why would gas stations sell this? Why would convenience stores sell substances that we know are addictive? And addiction, my friends, you have to understand it's more than just wanting something. It is needing something, and you're going to get it in your system no matter what, no matter how much it costs, no matter how much it hurts other people, and especially no matter how much it hurts yourself. So the reason these gas stations sell these substances, even though we know they are extremely harmful, is because it's a frequent hangout spot, right? It's super convenient. It's easy for people to pull up. Everyone who has a car, you have to get gas at some point. You don't really have a choice in the matter. So if you're getting gas, then you might as well go in, shop around, grab a snack, and then some people stop at the counter and pick up other substances as well. Next up, exposure to advertising. You walk into one of these places, I really want you guys next time to look around and just see and count up the amount of ads that are around on the counters, on the walls. They have little sections for every product that is advertising what it is. And they advertise it as healthy for you, as a way to boost your energy, a way to calm down. It's really accessible because there are a lot of gas stations, right? There was a meme I saw earlier. Somebody said, anytime you see construction in this area, it's probably going to end up being a Wawa. So there are so many built up on every single corner, on every single part of every borough in this greater area. Okay. So you really don't have to go far in order to find a gas station or any convenience store. Many of them are often in close proximity to high schools. So near every high school that I've ever been to, and I go to a lot of high schools, guys, within the same block or just with a few short walks away, is either going to be a gas station or convenience store that sells these types of products, unfortunately, to younger students, especially students who are at that age that they can. And finally, they're open all day long. Most of them are open 24 hours a day, or at least very early in the morning where you can stop in before you get to school. And they're open there after you guys are done with sports practice or with school as well. So they have good hours, a lot of advertising, they're always around, and they're always really close by to schools. All right, so what substances are we actually going to cover? Okay, we're going to split this up into two parts. So, part one, I really just want to cover nicotine because nicotine alone we could talk about for hours and hours. So, one really big program that Weller does teach is our vaping program because it's a topic that I think you guys should all learn about at least once. So, let's get into part one on nicotine, and then part two we'll discuss another time. So we're going to cover a couple different types of nicotine products just because there are so many now. So years ago when it came to nicotine and you mentioned that topic, most of the time it was just cigarettes. That was pretty much it. But now nicotine has changed in a lot of different ways. So there's more offerings that are available. So first, of course, we still have to cover just classic tobacco, all right? I know you guys have learned about smoking before, something every person I think has heard about, the dangers of smoking, but I really think it's important for you guys to just remind yourselves why smoking is so bad. Why is it something you learn about in health class and in school multiple times, okay? The reason why is more than 16 million Americans live with a disease caused by smoking, all right? 16 million people are sick as a result of smoking cigarettes. When you're smoking cigarettes, guys, cigarettes, I know we often think, oh, it's hurting your lungs, you're gonna have lung disease, which absolutely is true. But people forget that cigarettes harm nearly every single organ and bone and part of your body, from your head down to your toes. And I mean that very literally. That's not just an exaggeration. Cigarettes harm every single part of you. It harms your heart, it harms your gastrointestinal, it harms your immune system, your teeth, your brain, even your bones and your skin. Cigarette smoking is the leading cause of preventable death in and disease in the United States. So people who pass away from certain illnesses as a result of smoking, those are illnesses and deaths that could have been prevented if we could have educated that person sooner or managed to get that person to quit. But unfortunately, quitting cigarettes is extremely difficult with the nicotine addiction that happens in the brain. Okay. And finally, guys, cigarette smoking, and not only just directly smoking cigarettes, but secondhand smoke exposure as well, cause nearly 1 in 5 deaths. 1 in 5, that is a significant amount of people, again, whose deaths could have been prevented by not smoking in the first place. So cigarettes are truly one of the most harmful things we put into our bodies. I know for me, when I go to my yearly checkup, my doctor's appointment, one of the first questions they ask is, oh, are you a smoker? And the reason they're asking that is because just that one answer, that yes or no answer to am I a smoker or am I not a smoker, can determine so many different parts of my body when it comes to health. So automatically they'll know I'm more at risk for things like emphysema, brain disease, heart disease, as well as lung cancer. So just that one question can give a lot of insight into health. So just keep that in mind when it comes to the dangers of smoking. All right, my friends. Now, cigarettes were the smoke of choice for decades and decades of human history. All right. So think about your parents and your grandparents. Think about right now if you happen to have a family member who does smoke cigarettes. You probably do. I would say most of you, if you have grandparents that are around or parents that are around, most of them are probably cigarette smokers because cigarette smoking was so widespread for so long. And then in the late 90s, early 2000s, we started doing really great health campaigns trying to teach people the dangers of smoking. And it was widely successful. So many people either quit smoking or a lot of students ended up not becoming smokers in the first place. So smoking dropped very dramatically for a very long time, which was amazing. We had a whole generation of people who were no longer addicted to nicotine. Unfortunately, that changed in the 2010s with the rise of vaping. So I think all of you guys know what vaping is. I don't think I have to explain vaping. So vaping is now basically a smokeless, or you don't doesn't require a flame or a lighter in order to get nicotine into your system. Right? It's powered by a battery. So vapes have really evolved in a pretty short amount of time. So with us, we teach vaping. I teach vaping every single day or every week of the year. And the way that I teach it now is really different from the way that I taught it even when I first started doing this job 6 years ago, because vapes really have evolved. So 6 years ago, when I first started teaching vaping, most students were using the classic rechargeable vapes that had different types of cartridges or pods to refill them. Nowadays, though, that's not what you guys are using. Now you're using the classic disposable ones that can be bought at any gas station. Those are cheaper, they're a lot easier to get, and come in all those different types of flavors that are really attractive to you guys. So e-cigarettes have become the most commonly used tobacco product among middle and high school students. All right, that is what students are using at every school that I go to at many, many different ages, not even just at high schools. Some of them are rechargeable. I know the rechargeable ones are still around. They just definitely are not as popular as they used to be. But most often, when it comes to you guys using vapes, you're using the ones that are disposable. So they're meant for a one-time use. When they're empty, you throw it away and you buy a new one. So guys, when it comes to vapes, they do contain nicotine. It is an addictive product. I know the companies may advertise them that can help with energy boosting or calming you down. That's just really not the case, okay? This is an addictive product, okay? Nicotine is highly, highly addictive, especially to adolescent brain, okay? The amount of nicotine that's found in vapes is going to be basically the same amount of nicotine that's found in classic cigarettes, a single pack of cigarettes. So these are highly addictive, all right? It's not like you can use them and be like, all right, I can stop at any point. That's just not how it works when it comes to addiction. All right, so facts versus myths when it comes to nicotine. Okay, a lot of people believe that okay, vapes are safer because they're flavored. All right, keep in mind, guys, that flavoring that those vapes say they are, that's not all natural flavoring. When they say, oh, it's a strawberry flavored vape, do you think they're going out and picking fresh strawberries and juicing them up and then making that into vaping flavor? No, the vaping flavor they're using, it's full of extremely harmful and some of them even cancer causing chemicals. And those chemicals that are in vapes, some of those are safe for ingestion, eating, like I talked about earlier. They are not safe for inhaling. And the effects of inhaling those still just aren't studied fully. We still don't know the full effects of inhaling those types of flavorings every single day. A lot of people talk about Zins, which we'll discuss a little bit more. Zins are healthier because they're smokeless. They absolutely are not. Zins and any type of nicotine pouches, all right, at really anything that has nicotine, it's going to cause different types of diseases. Zins in particular can cause different mouth diseases, tooth decay, and even mouth cancers too. Vaping, is it addictive? It absolutely is. Vapes contain nicotine, all right, which is the third most addictive chemical on the planet. That statistic always really surprises people because nicotine is legal. You can buy it at any gas station, convenience store, at smoke shop right now. But nicotine is a highly, highly addictive substance, and it is harmful to your health. Vape clouds are just made of water vapor, all right? That is not true. I know you may hear people call it a vape, so you may think, oh, it's just water vapor with flavoring with nicotine. Don't let any company or person try to convince you of that. All right. I know there's a lot of misinformation online, but that is absolutely false. Sorry. Vape clouds are absolutely not water vapor. Water is usually not even an ingredient when it comes to vapes. Sorry. A vape cloud is called an aerosol. An aerosol is a fine mist of chemicals that you're inhaling. Okay. And it contains hundreds of chemicals oftentimes. And vaping is easy to quit. All right. Yeah, some people are successful in quitting. All right. If you happen to know somebody who quit smoking or quit vaping, all right, feel free to discuss it with your friends, but it's rare. It's more rare than people think. All right. Quitting is possible, but it's very, very difficult. All right. I know a lot of smokers in my family who smoked, who vaped, who did every nicotine product under the sun. And they would often talk about, oh, yeah, I'm quitting. I'm quitting. I'm quitting next week. I'm quitting next month. and they never quit. They're still a smoker or a vapor to this day. Okay. It's because when you quit any substance, but especially with nicotine, you end up going through withdrawal. Withdrawal is basically your brain going into shock from not having that chemical in your body anymore. And withdrawal symptoms can be pretty severe, especially with certain types of drugs, nicotine especially. And those withdrawal symptoms can be so severe that somebody can't handle it and they continue vaping or continue smoking. And eventually that can cause extreme damage to your health. All right, my friends. Next up, we need to talk about smokeless tobacco nicotine. All right. So, smokeless tobacco is things like Zins, chewing tobacco. So, these are not vapes, these are not cigarettes. It's the type of nicotine you're putting into your system orally that doesn't require a flame or a vaporizer or anything like that. Okay. So, when it comes to these types of nicotine products, right, a lot of people think, okay, well, I'm not inhaling it like I am with cigarettes, or I'm not inhaling it like I am with vapes. So, it's not affecting my lungs. That means these are healthy for me. They absolutely are not, my friends. If you are using anything with nicotine, you are harming your health. Okay. Zins, especially, I know so many people think, well, it's just nicotine and that's it. There's nothing else in it that can harm me. That is absolutely not the case. Okay. So when you're using these types of smokeless tobaccos, or smokeless nicotine products, you can get things like dry mouth, gum inflammation and gum disease, tooth decay. It actually slows the healing process. So when you get sores or infections in your mouth, it's going to make the healing time on that a lot longer than it was before. Bad breath, right? Not fun for the people sitting next to you. And actually an increased risk in oral cancers, especially with chewing tobacco. Chewing tobacco, when that causes different types of mouth cancers, friends, it's bad. It's it's obviously an extremely dangerous type of cancer, and it's invasive because when the doctors have to do surgeries to remove any type of tumors caused by oral cancer, what they have to do, guys, is they have to actually cut out portions of your jaw to fully remove that tumor and to make sure that cancer hadn't spread to other parts of the body. So people who have survived oral cancers oftentimes are going to have major parts of their jaw or their face actually missing. So it's one that ends up having a lot of physical effects later on after treatment. Okay. But again, it's also very dangerous too. A lot of people don't survive those types of cancers as well. Okay. So why is nicotine so bad? All right. We know it's addictive, right? Something can be addictive, but not hurt the body. All right. So nicotine definitely affects multiple parts of you. Okay. Number one, it harms your brain, especially yours, because like I said, your brains are still developing. It's going to weaken the parts of brain that control learning, memory, and impulse control. Next up is nicotine actually affects the heart and your blood pressure. Okay. So it's going to raise blood pressure. It's going to speed up heart rate. So when people are vaping or smoking or using nicotine pouches or chew, a lot of times you're going to get an elevated heart rate. Okay. And having an elevated heart rate like that all the time, over time, is going to end up weakening your heart and again, increasing blood pressure. It's going to put a strain on your blood vessels and increase your risk for heart disease. Okay. I would say your heart is pretty important. So we want to take very good care of that. Next up, friends, it can cause mood swings, make you extremely irritable, restless, can give anxiety as well. So think about somebody you know who does smoke or vape. When they go too long without smoking or vaping, how are they? How's their mood? Are they pleasant to be around? I'm gonna bet that they're pretty rotten, pretty terrible, because when you go too long without nicotine, you feel those effects extremely quickly, okay? Because your body depends on that substance to get you through the day. So when you go too long without it, you're gonna feel miserable very, very quickly. And finally, guys, the harmful aerosol that we see, especially in vaping, is going to harm the lungs. It absolutely does. We see damage to the lungs. I talk to doctors at the hospital all the time when it comes to the effects of vaping, what they're seeing on lungs. And it's scary what they're seeing. They're seeing scarring, damage to the delicate lung tissue. And those are things that can't be fixed, all right? With all the time in the world, once you damage your lungs, that damage is forever, okay? And especially for those of you who are athletes, it can affect your athletic performance. Imagine you're playing basketball and halfway down the court, you got to stop and catch your breath because you're vaping all the time and it's now impacting your lung performance. So, nicotine, my friends, is an extremely harmful substance. Vaping is a harmful substance, nicotine pouches, and cigarettes, of course. So, please, I know you may see family and friends who smoke and vape, and they may say otherwise, but just I'm going to ask you one question. Do you think people who are smoking and vaping, all right, they probably really like it, right? Because they're addicted to it, they enjoy the feeling. So, do you think they're going to be a reliable source of information when it comes to the health effects of smoking and vaping? Probably not. And social media is no better. When you go on social media and watch TikToks and Instagram Reels and YouTube Shorts, you're probably going to hear people talking about vaping and smoking in different ways. But again, you can't always rely on that information. You have to go to sources that are backed up by science and backed up by research, right? Those are the types of information sources that we want to be going to. All right, so that's it for part one. Part two next week, we're going to talk about a little bit more about marijuana, marijuana products that are currently sold, ones that are not sold. We're going to talk about something called kratom, which you may not have heard before, but I think will be a really interesting topic. Thank you all for listening. I hope you guys have a wonderful rest of your day. Have a wonderful rest of your week, and I will see you in the next video. Bye.